Hi, this is Richard from SEN Talk. This video is all about Obsessive Compulsive Disorder, or OCD. We'll be looking at some of the myths behind OCD and some of the real facts behind them. The first myth we'll look at is that OCD isn't a real thing. Well, OCD is recognised as a neurological condition. It means somebody's brain is wired differently. OCD often develops in early adulthood and can be severe and long-lasting. OCD is made up of two things, obsessions and compulsions. The obsessions are intense, negative, repetitive and intrusive thoughts, which may be completely irrational, but also they can be very distressing. Someone may think that family members might die because of something they do or don't do. They may also be worried about actions they might take. For example, they might avoid balconies because they think they might jump off them. These obsessions can often lead to compulsions. These are regular behaviours or rituals which the person uses to relieve the distress of the obsessions. This may be a repetitive behaviour, such as counting, repeating movements, washing, cleaning, ordering or arranging things, hoarding, or tapping and touching. If the person doesn't use these compulsions or rituals, they will have serious anxiety from their obsessions. So OCD is a chronic feeling of doubt or danger. The obsessions are difficult to rationalise, they really don't make sense. They're also difficult to control and get rid of. Another myth that you often hear is that everyone's a bit OCD. Well, OCD in fact only affects 1 to 2% of the population. Although people will see somebody's rituals or repetitive behaviour, OCD is in fact defined by their unseen thoughts and fears, the obsessions we talked about earlier. Their compulsions or rituals can provide short-lived relief, but their intrusive thoughts soon return and create a repetitive cycle. These make daily life difficult to navigate, can be time-consuming, taking up hours every day, and can be very tiring. They disrupt daily life, relationships and work. So saying that everyone is a bit OCD really shows little understanding of the real condition. Some people think that you can always see when someone has OCD. Well, in fact, you've probably met many people with OCD and never actually noticed. People with OCD are often able to suppress or hide their symptoms in public. Some have no rituals at all. Some perform their compulsions entirely inside their head. For example, in response to a distressing thought, someone may need to recite a specific phrase several times to reduce the anxiety, but that won't be seen by anybody else. So you can't see if someone has OCD. There is a myth that people with OCD just love keeping things neat and organised. You often hear the comment that you're so OCD, or that this will annoy someone with OCD. Some people with OCD may have tidying and cleaning rituals, but they don't enjoy them. Also, not everyone with OCD has tidiness rituals. All the people with OCD are different. And in fact, over half of people with OCD are actually hoarders. They accumulate unneeded items, which gets in the way of their living space. So that's hardly keeping things neat and organised. There is also a myth that OCD is just about cleaning or being scared of germs. As we said before, OCD affects different people in different ways. Some do have fears about getting sick themselves or getting other people sick. As a result, they develop rituals of washing their hands repeatedly, sometimes until they get sore. But not many people with OCD actually have a fear of germs or have cleaning obsessions. There is a myth that OCD is caused by a troubled childhood. It's not yet been possible to identify an exact cause of OCD in each person, but it is known that OCD is not caused by religion, culture, or as some think, late toilet training. OCD is a neurological condition with differences in the brain. There is suggestions that there is a genetic link, which means that children may have a higher chance of developing OCD if their parents or grandparents have had OCD. Also, the chance of getting OCD may also be increased by certain life events, if somebody was bullied, abused, or if they experience certain events in their life, such as childbirth or death in the family. Some people think that people with OCD are just weird or neurotic. Many people with OCD know their thoughts and actions are not rational. They don't make sense. This makes it even more frustrating for them. Others may think that they can just stop these thoughts or rituals if they really try, but that's not true. Some people think that OCD rituals can be funny. It's true they can seem absurd, illogical, or irrational. However, for the person with OCD, they are very distressing, debilitating, and frustrating. It's certainly not funny for the person with OCD. In fact, research has shown that 40% of people with OCD experience depression, 60% have suicidal thoughts, and 25% have actually attempted suicide. There is a myth that people with OCD should just learn to live with it. There's no reason to put up with OCD. Obsessions and compulsions can be chronic and distressing. They can have a serious and long-lasting effect on someone's quality of life, their relationships, and their social activities. Their obsessions may change, but they also may worsen over time. Talking therapies and medication may help to manage their thoughts and habits. Some people think that a person with OCD should just relax. They may say, just stop doing that, or nothing will happen, or you don't need to check that yet again. However, it's very difficult or impossible for the person with OCD to change their thoughts or behaviours. It's very difficult for them to dismiss their anxiety or fears. Their thoughts may get worse, and they simply can't be turned off. In fact, many people with OCD feel that they are imprisoned by their own mind. So what is OCD? It's a lifelong neurological condition, which means that someone's brain is wired differently. It affects all nationalities, ages, cultures, religions, and social backgrounds. It has a wide range of characteristics, and each person with OCD is different. OCD is defined as having obsessive thoughts and also compulsive behaviours. The obsessive thoughts are based around something bad happening to that person or their family. The compulsive behaviours are regular rituals, and these are intended to relieve distress in the short term. People with OCD may think that the fate of others is determined by their actions. This can be very difficult to understand. And they probably know that the rituals are not necessarily going to change anything. However, they don't want to take the risk. So what can help a person with OCD? Medication is available, but it doesn't always help. They may also be able to get access to talking therapies, such as CBT, where they can better understand their fears and rituals. It's important that someone with OCD is honest to themselves. They also tell other people about what they're experiencing and ask for help. They can look for a referral for diagnosis and also look for local support groups. We hope that video has been useful to dispel some of the myths about OCD and give some of the facts behind this condition. SEN Talk provides a range of advice and support services for families and children with a wide range of neurodiverse conditions. If we can be of any help or you need any further information, please do contact us.